A young child with moderate to severe eczema should be tested for food allergy if they have an allergic reaction to the food. What really constitutes that allergic reaction? Well, obviously, a lot of us know about the trouble breathing or swallowing, but in your child, you may also see them get hives or swelling. They may get stomach cramping, nausea, vomiting, diarrhea. They may have a headache. And if it gets really extreme, they may develop a drop in their blood pressure along with weakness. The other thing is, in infants especially, we look for if they're getting very fatigued, or what we call in the clinic is lethargic. So meaning they could be inconsolable or not have any energy at all. What about which foods cause these allergic reactions? Some of the foods that are related to these reactions are the most common core foods, which are egg, soy, milk, wheat, and peanut. We also try to keep an eye on fish and shellfish to see if they could also potentially be triggers for this allergic reaction. Your allergist may also decide that if you're not responding with the standard of care and with emollients to your eczema, maybe at that time to also test for food allergy. What else could we see in terms of when you go to the allergist, what type of testing? Well, I may use a combination of prick skin testing. We may also do blood testing, and then leading up to possibly doing an oral food challenge. The skin prick testing involves a small plastic device which we use to superficially puncture the skin, and hopefully it gets you results within 15 to 20 minutes right at the clinic visit. However, there are other patients where I may be looking for specific markers, and I may decide that I want to go ahead and do a blood test. And lastly, depending on the results of these, we may decide to proceed with an oral food challenge where I give you a little bit of the food and gradually increase that food over time to make sure whether you develop an allergic reaction or not. If we do identify a food allergy, what can you do? My advice would be to partner with your allergist. Partner with them to develop safe strategies to use at home and with family member and friends, to also use with your school and with your community. This will be the most successful approach and really bring home the idea that you are working in a community and we are all working together to heal your allergies.